70 is also slow. Abby, Nick?
Okay, thank you, Carrie. Well, November is just a few days away, and you might see men in your life begin sporting mustaches.
Yes, this is to fight cancer and support mental health. Movember U.S. Executive Director Mark Hedstrom joins us live this morning to explain the Movember idea and why it's important. Good morning. I appreciate your mustache, Mark. That's perfect.
Good morning, Abby. Good morning, Nick. Thank you for having me on.
Absolutely. So what is Movember?
So Movember is the global men's health charity focused on changing the face of men's health. And we focus on three areas in our causes. One is prostate cancer, second is testicular cancer, and the third is mental health and suicide prevention. And throughout the course of November, we ask men and women across the U.S. and across the globe to engage in a conversation around men's health and actually fundraise on behalf of men in their lives to support both research in prostate and testicular cancer, but also helping men navigate some of the challenging points in their life with respect to physical and mental health.
So this is a part of your new campaign that you're launching, is that right?
We've been around for 19 years, actually. We were founded in Melbourne, Australia back in 2003, and we operate in 20 countries around the world. And to date, we've had over 6 million men and women across the globe join us in this movement to engage in a conversation around men's health, reduce the stigma, and also focus on raising awareness, but also very much needed funds to support prostate and testicular cancer research, as well as mental health and suicide prevention.
And so how do you recommend people engage with a friend who you may know is struggling with maybe a cancer diagnosis or even mental health issues?
Well, I think it's important to start with looking at what we're focused on in terms of awareness. So just to give you some top line stats, in the U.S., and this is something we see across the globe, men die 6 years earlier than women, often for preventable diseases or preventable issues. And we focus on prostate cancer. 1 in 8 men in the U.S. will be diagnosed with prostate cancer in life, very similar to what we see with breast cancer amongst women. And amongst black men, 1 in 6 men will be diagnosed with that disease in their lifetime. So it's raising the awareness around those issues and understanding exactly what kind of risks men may have. In testicular cancer, between the ages of 15 and 34, it's the second leading cause of cancer. And with respect to mental health and suicide prevention, in the U.S., we lose 100 men a day to suicide. And that's a real challenge when we look at that. And 3 out of 4 suicides in the U.S. are men. And that's a very similar statistic we see across the 20 countries that we operate in. So starting with that awareness and some of the challenges that men face, and then engaging men directly in that conversation, and giving them the opportunity to talk about what might be going on in our lives is where we start with the conversation. We use a mustache often to have that conversation, but really opening up the opportunity for those men to engage and for those around them that care and love for them to actually engage them in that conversation and help them take action for their own health.
Mark, what are the 5 things to know about men's health that can save lives?
Well, I think it really starts with some of those statistics. So raising the awareness and reducing stigma would be number 2. Engaging in a conversation with men around the issues they might be facing. And oftentimes what we've found is first starting with just asking a question as to how a man is doing, and not, sort of letting go with a simple, good, I'm fine, but engaging them a bit more and listening to what they might be saying to you, and then encouraging them to take action. I think if you look at awareness and stigma, probably one of the biggest challenges moving beyond that is getting men to talk and use vocabulary that they feel comfortable with, but then encouraging them to take action. And then finally, a lot of the tools on Movember.com point to this as well, as connecting and making sure that you check back in with those men. So if you're encouraging them to take action, make sure you follow up with them around that issue or what else they might be facing, and encouraging them to continuously engage in their own health.
All right.
Yeah. Isolation is bad, and connection is the way to go. That's for sure. Mark, thank you.
Absolutely.
And Fox 4 wants to remind you that you matter. So if you or someone you love is struggling with their mental health, call or text the Suicide Crisis Lifeline at 988 to talk to someone about getting help. We also have resources at fox4kc.com/youmatter. We'll be right back.